Hello, my name is Camilla Hubner, and I would like to first thank you for tuning in to my podcast, The Code. The topic that we will be discussing today is very serious. It is a basic human right that anyone deserves, this right being healthcare. All people, whether they be rich or poor, young or old, no matter their race or gender, deserves a basic right, the need of healthcare. So today, we will be defining what is healthcare, what Pakistan has done right, what Pakistan can improve in their healthcare, and what the future of Pakistan's health system possibly holds. Healthcare is something that we often hear talk about in the news with regards to Medicare and Medicaid, for-profit and non-for-profit hospitals, and so on. But do we really understand what healthcare is? To gain a better understanding, I looked up the definition of healthcare, which according to Merriam-Webster's dictionary definition, healthcare is efforts made to maintain or restore physical, mental, or emotional well-being, especially by trained and licensed professionals. Healthcare is something everyone needs, especially third world countries like Pakistan, where resources for proficient healthcare are limited. What has Pakistan done right in their healthcare? Pakistan is the sixth most populated country in the world, with about 185 million people, and by 2050, it will become the fourth largest populated country in the world, meaning that there are a lot of people that need providers and medical facilities to stay healthy. The first thing that Pakistan has done well is expanding their healthcare to more rural areas through telecommunication, which is through video chat or phone call. This allows those who live far away from medical facilities receive necessary care in a timely and cost-efficient manner without having to travel long distances and spend outrageous amounts of money. The second thing Pakistan has done is by having patient charting be moved online instead of on paper. This allows patients' information to be more accessible to their healthcare providers and keep better track of visits, medications taken, allergies, health history, and immunization. Thirdly, what Pakistan has done well is by implementing a primary, secondary, and tertiary preventative health measures. This allows to help stop the spread of illnesses. There are many healthcare systems that exist in Pakistan. One of the many ways healthcare is provided that proves the most effective is through the primary measures, which are vaccinations to help prevent diseases, secondary measures, which deal with diagnostic tests to help catch diseases early and treat them, and tertiary measures, which deal with recovery after surgeries and illnesses. But what can Pakistan improve upon? Firstly, Pakistan needs a national healthcare policy. The healthcare system has tried numerous times to establish a national healthcare policy without success. This has caused such great stress on the system that former Vice Chancellor of a university in Pakistan, Professor Javed Akram, said that there is a need to declare a health emergency for 5 years to make healthcare a priority. He said that at present there is no short-term, mid-term, or long-term health policy in the country, due to which we are facing numerous issues. Secondly, there is a great need for female doctors who have stopped working after they get married. With the culture of Pakistan, once a woman gets married, she needs permission from her husband and relatives to go back to work. Many women who are doctors do not receive this permission and are greatly needed due to many women seeking medical attention and only wanting to speak and be examined by females creates a large issue. Thirdly, an inadequate amount of the GDP is being used for healthcare. Pakistan is spending 0.4% of its GDP on healthcare, and this amount is about 5 billion Pakistani rupee, which is not very much. This is mainly provided by out-of-pocket payment, government revenues, developmental partners, private insurance, external resources to NGOs, and world funding. It is also supposed that 78.08% is contributed through the out-of-pocket mechanism. General taxation is a major source of government's financing for health. meaning that most of it is coming from the people of Pakistan when more could be contributed from other sources, cutting costs of healthcare. In conclusion, unfortunately, Pakistan was unsuccessful at attaining previous Health for All goals that they had hoped to meet in 2015, meaning that with it being 2019 now, Pakistan still has large amounts of improvement to make. Pakistan has also settled the National Health Vision 2016 to 2025 to improve the health of all population, particularly women and children, through universal access to affordable, quality, essential health services, and delivered through resilient and responsive health systems. No country is perfect, and there are always things that can be improved upon. The only hope is that Pakistan will continue forward towards their national health vision for 2025, and that we as a nation can all take a stance to fight for better, more attainable healthcare to all. Thanks again for tuning in. This is Camilla Huebner signing off, and stay tuned to see what we will learn more about next time on The Code.